No one wants to get sick during the flu season, but should certain people be forced to get the flu shot? It's a debate that has acquired much controversy around healthcare professionals as calls grow for mandatory vaccination. Hi, my name is Melissa, and here is my 3-minute pitch on why healthcare providers should not be required to have the flu vaccine. Influenza, also known as the flu, is a continuously evolving virus. It quickly undergoes mutations that alter the properties and composition of its antigens. Due to these changes, acquiring immunity one year will not necessarily mean a person will have immunity in the subsequent years, as a different strain and virus will be circulating. Despite these facts, healthcare authorities continue to recommend all healthcare providers to have annual vaccinations against influenza. Mandating flu vaccinations have been greatly challenged for several reasons. The effectiveness of the vaccine remains questionable. Several life-threatening adverse effects have been linked to the seasonal flu vaccine. There has been no reliable evidence to validate that vaccinating all healthcare providers would substantially benefit patients, nor would it minimize patient morbidity or mortality, as well as notable inconsistencies have been established in the application of the policy. However, there remains subjective concerns regarding healthcare providers' apprehensiveness of receiving the flu vaccine, as they are found to be at greater risk of contracting the flu. Vaccines have been shown to decrease the transmission of the disease. It has been declared that health providers have an ethical and professional obligation to act in the best interest of the patient and prevent harm, as well as vaccinations increase patient safety. When vaccination is overemphasized, basic infection control measures are overlooked. Health promotion and prevention strategies that stress on immunization are not frowned upon, although when there is clear scientific evidence that emphasizes the lack of effectiveness in this vaccine, other strategies should be suggested and encouraged. These alternative strategies that have been deemed sufficient alternatives to vaccinations and decreasing the transmission of the disease is through the use of proper infection control measures. This compulsory action by healthcare authorities infringe on human and staff rights and autonomy, as vaccination is not the sole avenue for preventing viral transmission. Therefore, mandating vaccines cannot be justified. In all, we can agree that the influenza infection is a significant public health issue that needs concentrated efforts in order to relieve the social burden in hospital settings and beyond. Though it is crucial to consider that there is more than one strategy that can be used to achieve the overall desired outcome. Year after year, we are continuously reminded to get our flu shots by advertisements, pharmacies, doctors, and now our employers. However, for healthcare providers, this is no longer by choice, it's an obligation. With this lack of evidence on the effectiveness of the flu vaccine, will you submit to your rights as an individual? Thank you.